1993, the American Southwest. A sudden cluster of healthy young adults began dying.
The anomaly was immediate, completely unexplained mortality. Not elderly, not immunocompromised. The victims were active, hikers, athletes in their prime.
Within days, rapid cardiopulmonary collapse, a devastating 40% case fatality rate. Doctors had never seen this.
The vector was not a bioweapon. The killer was an ordinary deer mouse carrying a virus. The rodent is a lifelong reservoir. It never gets sick, it continuously sheds the virus into the environment. Transmission zones are entirely mundane. Closed cabins, garages, barns, wood piles. The droppings dry out and become airborne. Step 1, walk in. Step 2, disturb dust. Step 3, inhale. A single microscopic breath travels deep into the alveoli.
The target is specific, endothelial cells. The virus attacks the inner lining of the blood vessels, not the lung tissue.
It binds to a surface protein, integrin beta-3, a literal doorway to hijack cellular machinery and replicate. A silent invasion. The virus spreads cell by cell through the blood vessel lining, completely invisible to the immune system.
Incubation begins. 1 week, 6 weeks. By 8 weeks, maximum replication is achieved. The patient feels nothing.
No fever, no fatigue, no warning. The immune storm arrives. When detection finally occurs, the body's own response begins to destroy the patient. T lymphocytes and cytokines flood the tissue to eliminate infected cells. This crossfire physically breaks down the blood vessel walls. The walls become permeable, leaky. Blood plasma drains out of the circulatory system directly into the tiny air sacs of the lungs. Non-cardiogenic pulmonary edema. The lungs rapidly flood with fluid. The heart is not the cause. The immune storm continuously escalates. The timeline violently compresses. 3 to 5 days of mild flu symptoms becomes severe respiratory distress in mere hours. An autopsy of failure. 3 interconnected cascades occur simultaneously. 1. Flooded alveoli block oxygen. 2. Dropped blood volume fails the heart. 3. Systemic inflammation damages vital organs. Serious. Hypoxia. Blood oxygen saturation falls rapidly. The brain and vital organs are starved. Distributive shock. The circulatory system collapses from the inside out. Even with maximum support, the body is losing to itself. Yet, if a patient survives the first 72 hours, the immune response can resolve. The fluid absorbs, recovery is possible. The margin is razor thin. The window between survival and death is measured strictly in hours. Can doctors stop the flooding? Can we hold the body together long enough to survive this storm? We examine the intensive care unit battle in part 2.